Hello, everyone. I am Shanta Jackson, your facilitator with the Healthy Heart Learning Collaborative. Welcome to today's peer learning session. We're at 6 o'clock on the dot. Let's give it about 30 to 40 more seconds before we begin. In the meantime, Lydia, please be sure to add the agenda to the chat. Hi, Emily.
Hi, how are you, Shanta?
I am doing well, thank you. Hi, Arnold, Rajavi, Daryl, thanks for joining. Okay, so let's go ahead and get started. Again, everyone, I am Shanta Jackson with Cause Engagement Associates. We are the facilitator of the Healthy Heart Learning Collaborative, which is a program of the Maryland Department of Health. And today's topic is planning ahead for your health, making decisions before a crisis. And also, I want to say happy World Health Day, happy Public Health Week, and happy Minority Health Month as well. Okay. And so everyone, again, welcome. This is a community peer learning space. Everyone's experience is valid. Share what you are comfortable sharing. So if you find yourself kind of quiet, I challenge you to step up. We'll give you some time to process. But if you feel like if you notice you're the only one kind of speaking up, I challenge you to step back a little bit as well. But again, share only what you feel is comfortable, and you may unmute yourselves and ask a question or speak, or you may use the chat. Okay. And so what you will learn today is it is our intent by the end of this session, you will have a better understanding of why planning ahead for heart health related decisions is important, how advanced directives and basic estate planning can support healthcare decision making, and how to begin conversations about your preferences with your loved ones, and then also the role of designated decision makers in shared planning, and some practical steps to take now to feel more prepared for future health events. And before I introduce our guest speakers, I did send this yesterday via email, but for those of you who registered today, we do ask if you all have any questions. And one of the questions previously posed by a participant in a previous session was to explain the difference between a heart attack and cardiac arrest. So I just want to take the time to do that now. So a heart attack occurs when blood flow to the heart is blocked. And so this is often by a clogged artery. The heart is still beating, but it's not enough oxygen. Versus your cardiac arrest is an electrical problem. And so cardiac arrest is when the heart is suddenly stops beating. Again, your heart attack is more circulation, and that's a blood flow issue. And cardiac arrest is an electrical problem. Any clarifying questions there? Okay. Okay, and it's also important to know that heart attack symptoms can look different in different people. So for many people, including men, the most common symptom is chest pain and discomfort, but it's a little different for women. So chest pain can still happen, but it may feel different. And some women describe it as a pressure in the upper back that feels like squeezing or tightness. And women also may have other symptoms that don't always seem related to the heart. So for example, feeling anxious, having short breath, upset stomach or nausea, feeling lightheaded, again, that pain in the shoulder, back, or arm, and having like an unusual tiredness or weakness. And so these symptoms can be mild and they may come and go. which may make them easy to ignore. However, if you have one or more of these symptoms, or if something doesn't feel right, it's important to take it seriously and to call 911. And you can learn more at the American Heart Association's website. We'll put the link in the chat. Again, it's important to take this seriously and call 911. Any questions, any comments? Okay,
Hello, everybody. I just wanted to say hello.
hi, Daryl. Thank you so much for joining and hello.
Oh, yeah. No problem. No problem.
Okay. And so at this time, I would like to introduce our speakers. And so we are joined first by Stephen Kappen. Stephen is an attorney with the with the Maryland Volunteer Lawyer Service, who will discuss basic estate planning considerations. And then we're also joined by Dr. Sadie Peters. She is the medical director with a department within the Maryland Department of Health, and she is going to share information on advanced directives and advanced care planning. So at this time, I will step back and I will pass it over to Stephen.
Hi, everyone. My name is Stephen Kappen. I work with pro bono clients and I help them do estate planning with the Maryland Volunteer Lawyer Service. Today, we're going to be talking about estate planning basics and introducing you to the most common documents used in estate planning and how you all can use them. And then we'll also have some time for questions. So I have some slides for you. I'm going to start sharing them. And I think just as a starting place, just for my portion of this, I really want to focus on with you all that the number one thing you can do with when you're doing estate planning is actually talk to people. Many of my clients um, have very reasonable and normal and human aversions and reasons they don't want to talk to people about these documents and about what they want to do. However, I think I really often counsel people that this argument or discussion or friction is going to happen. You are just trying to figure out when it's going to happen. Um, and then also, when you do it in advance, you are helping people, you are still able to help people with your actual voice rather than what you have put down on paper. So you can help answer questions, you can help clarify what you meant. Once someone has transitioned, when someone's no longer with us, they can't always help us understand what they meant by what they put down in a will or what they put down on a power of attorney or why didn't they put someone on the advanced medical directive. Um, so today, all of these documents help people with estate planning. And then some of them help people with supported decision making. So we're going to talk about the difference and talk about power of attorney, advanced directives, wills, deeds, and trusts as well, and a little bit of the differences. So one thing to note, exactly what is in an estate plan. Um, at the Maryland Volunteer Lawyer Service, we're doing what I would consider the basic estate plan, which is an advanced directive for supported decision making when it comes to medical decisions, a power of attorney for supported decision making when it comes to financial and practical decisions. Um, and those documents are supported decision making because they're effective before someone passes away. And then when someone passes away, they no longer have a power or an effect. So all their effect is derived from someone, the person who's making the document, being here with us. The deeds, life insurance, those types of things fall into those categories, but they're a little bit more general documents. Wills and trusts actually, trusts can bridge the gap. They can be relevant when we're talking about things that are happening in the present day, but both of them are very important for what happens after someone passes. Um, so you can see how all of these are a little bit different. A will, for example, only is effective after someone has passed away. But all of these documents on this list, like I said, talking to your loved ones, looking at your actual deed to your property if you have one, looking at life insurance policies, looking at bank accounts individually and assigning someone as a payable on death recipient. All of these things are part of estate planning. An estate plan, I think you have a good one if you've planned for your care up into sort of the end of life, and if you planned for your assets afterwards. So I think those are the two really big things you're looking at when you do an estate plan. You want to make sure that you are taken care of and you have what you need um, going forward, and you want to make sure that there is a plan for your stuff or anything you want to pass on. And I think it's really important here that, especially in my context, I work with a lot of clients who are getting pro bono services. They often say, I don't have a lot to give away. Um, but I think a lot of times I encourage people to think about when you're thinking about your loved ones, after you may have something that you just want someone to have specifically, or you might want to have something you leave with them, or a message, or a client of mine is writing letters, so she has letters that she wants to give away in her will to people and make sure it gets to certain people. So it doesn't have to be big. It doesn't have to be it doesn't have to be a whole house when you're doing estate planning. It's really important that for everybody, you think about those other parts of it, the advanced directive power of attorney that might come into play when you are needing healthcare, when you are needing support at the end of life. So we're going to start by talking about power of attorney and exactly what that is. Um, when we're talking about a power of attorney, we're talking about a document that appoints an agent to make financial decisions for you. And it is something that we talk about. The agent part of it is just someone making decisions for you. So for a lot of people, that's their child, that's their niece, that's their nephew. Um, it's maybe a brother or sister. It's just somebody who acts on your behalf. So the person who's making a power of attorney has to be an adult. They're giving away some of their authority to another person to step into their shoes and take actions for them. Why would you need it? So that someone can handle your finances when you are unable to, or when you can't. It can also help avoid the need for a guardianship. A guardianship is a type of legal proceeding. You all might have seen this in your own lives, where an adult is unable to manage their own affairs, so a court has to step in to appoint someone to manage their affairs. And that's a very simple description of that. But the power of attorney lets you do it in advance, and you don't have to go through a guardianship proceeding. So it's a form that you can fill out. Um, I advise that everyone get advice before they make a power of attorney, because these are very powerful forms in the sense that when someone has a power of attorney, um, they can do a lot of different things. So now the person who is the agent that you've given power of attorney to is supposed to be able to act on your behalf and for your benefit. But once they have that paper in their hand, you have to make sure that's someone that you really, really trust. Um, Here you can see that when the power of attorney agent is technically a fiduciary. So like I said, it's someone who has to act on your behalf. It's someone who might be involved in your supported decision making, but they do have to act in your best interest. However, once they have that paper, they do have a lot of different powers, especially if you're using what people would call the statutory or standard Maryland form. Um, and this comes with a lot of danger. Um, when someone has that much broad authority, you have to make sure that they are someone you trust implicitly. I always say it's someone that we trust. If we put money in their hands, they would act on our behalf. We can limit that danger, and I think it's important to walk away from this knowing that you can give less than absolute power. You can make it not effective immediately. You can make it limited so that it doesn't last forever. Maybe you have a procedure where you want someone to only have power for a couple of months while they're helping you, and then end after there. You could also have joint agents, like two people have to agree. Um, depending on the context and what's right for you, that can be better or can be worse. But two people being involved might help there be some oversight. Um, and you really want to consider their trustworthiness. Like I said, if you gave them money, if you put your money in their hand, just cash, would they use it on your behalf just because you said, please use it on my behalf? Some things, would they be tempted to take the money for themselves? Do they have, an outside pressure, maybe like debt or gambling that would cause them to, maybe misuse money? Do they know about do they have financial knowledge or financial education that will help them to use your money effectively? Um, and I think it's just important to know that in Maryland, there are statutory forms. I always say that you can find these if you search Maryland statutory power of attorney or Maryland power of attorney, you might see something like this. You can download these from the Attorney General's website, which is what I would recommend. That will make sure that you are getting the statutory form, you are getting the one that is actually in the law. Um, let's talk about advanced directives and what they do. So, power of attorney, I like to say, is um, everything except the medical for the most part. It covers a broad swath of things. If someone could do real estate transactions, they could take money out of your bank account. They could uh, get an attorney to help you out with something. The advance directive is very specifically targeted towards a different type of problem. Like, what do we do about medical decisions? And Dr. Peters is going to talk about some cool options that you have in Maryland for how you can make sure that this document gets to all your doctors appropriately and gets everywhere it needs to. But what does it do? So I'll talk about it briefly. It appoints an agent to make medical decisions for you when you can't make them yourself. So this is also in a way, there's if you were there and you can make decisions, the advance directive doesn't override you. It doesn't make it so that someone can make decisions instead of you. You have to be already in a position where you can't make those decisions. An important thing is it might let them have HIPAA protected information, so information that they might not be able to get. They might be authorized, but you got to make sure that's in your advance directive. It also helps for other reasons because you can pre-choose some end-of-life medical decisions. You can just say, this is what I want if I have to be hooked up to a ventilator. If I go into a vegetative state, this is what I would want to happen to me. It also includes organ donation and funeral decision maker authorities, which are really important because the advance directive really is coming into play oftentimes when you are in a life-threatening medical situation. So end of life medical preferences, organ donation, whether or not you want to be one, and the extents of that. And then also the authority to make funeral decisions are really, really important. But like I said, Dr. Peters is going to talk about that a little bit more. Like I said, comes into play after someone passes. So power of attorney stops existing when someone passes. Who can now manage your affairs? Typically, that is the person that you name in your will. The personal representative in Maryland is typically what some people know as the executor. So they get to manage your affairs. They get to, if the house needs to be transferred via deed, they would do that. If we need to distribute the items from a curio cabinet, technically the personal representative is the person in charge of doing that. If you are in charge of any minor children, that the will itself can appoint who would be the guardians of the minor children. So that's a really important thing for a lot of people who, a lot of people put off estate planning for a long time. For a lot of people who are fairly young, they might have minor children. And so it's really, really important to get that will prepared and set in place because one of the most important things that the will does is appoint those guardians of your minor children. So when I'm talking to people who are not of the typical age to be estate planning, I really, really remind them and I remind everyone here that estate planning is for everybody. Everybody should do it. It's just a protective thing that you're putting in the background. Um, you know, I think I think some people have maybe some superstition about doing that estate planning, and I definitely see that, but it's better to have it because if something drastic happens and you have minor children, that's when you actually need it. So we're just putting it into place. take an afternoon, um, and get it knocked out. So what is your estate? Um, it's important to understand this part because the will only operates over what is your estate items. So when you have like life insurance, or something that transfers automatically to a beneficiary, it's not actually included in the estate. So if you have a life insurance policy, you gave that to your first child, when you write up your will, you might want to remember that and say, okay, I'm going to give the rest of my stuff to my second and third child, not the first child, because I already handled them with the life estate policy, life insurance policy. Um, but all you can make that planning, you can split that up, whatever makes sense, right? Like when you get some good advice, when you talk to an attorney or, um, you go to a presentation where they can go into it more depth, you get some good advice about how you want to actually split up those assets. But what you need to know is that your estate is only, that stuff, that you own when you die, not the stuff that transfers automatically. And this is important because the stuff in the will has to go through probate, which takes a while. The government runs that process. You have to go to the Register of Wills office in Maryland to kind of get that process started. And I imagine if anyone on the call has done that, they know that it can be time intensive. It can be complicated, and they'll have another opportunity to charge taxes and fees to you. So uh, it takes less time if you have less stuff to go through probate. It takes more time and it takes more fees and taxes if you have a lot of assets at the time of death. Um, a lot here being in the multi-millions, um, which a lot of people are worried and talk about the estate taxes. Those don't come up a lot in my situations, because it does only apply when you have over 5 million assets at the time of death. Uh, and we always say that like, definitely make sure you get your estate planning done if you expect to have 5 million in assets at the time of death. Um, Make sure that someone makes you a perfect estate plan to help you minimize your estate taxes. Something that is more relevant and comes up a lot in my cases is that there is Maryland inheritance tax, which is separate from the estate taxes. And it applies to people who aren't in your direct family line at this point. And whether or not it applies, whether or not stuff goes through a will or a trust, or you can't avoid it with a trust, which is what people ask a lot. It is 10%. So I talked to a client who had a house. She doesn't have any children. She wants to leave it to three nieces and nephews. And so I had to tell her that each one of those gifts would come with a 10% tax. So 10% of a third of a house is a fair amount of money. So you got to know about this one. If you have any nieces and nephews that you want to take care of, family, friends who you might even want to include. Um, so, so look at here. Some things to note. If you have a romantic partner that you haven't made an official legal relationship with, they would be covered under this inheritance tax. Their children would be covered under the inheritance tax. I've had a lot of blended families where people didn't get formally adopted. So we got to take a look at that. Um, so it can be complicated, and a lot of people don't know about this one. You can do a lot of your deed work in advance if you have real estate. You could put someone else's name on it in the present day, or you can use something like a life estate deed, which in Maryland would help you transfer your property, essentially be a beneficiary. Um,
Stephen, can you go
yes.
back to the slide with the exemptions?
Yeah. Yeah, I can.
Just only because we talked about individuals who can be taxed. So just for clarification, um, do you mind going over the folks who are exempt and what does exempt mean?
Yeah. I totally can. So this inheritance tax, this 10% tax, uh, you will have to imagine that it first started applying to everybody and they started cutting people out. So they cut people out that were like your spouse, makes sense. A registered domestic partner, which is a relationship that is legal, but it's like marriage, but not the same. So you can have a registered domestic partner. They're also exempt. Your descendants, like your kids, are exempt, and your siblings are also exempt. And then also your grandparents are exempt from this tax. And then when you start giving it to certain types of entities like a church or a nonprofit, those are also exempt from the tax. Um, so it is, I think it's a fair approximation. Like it's fair, it gets close to just say that like your nieces and nephews, your aunts and uncles, those are the people who are really going to get hit with this tax. Cousins, they're really going to get taxed by this. Um, but I have seen people, have a romantic partner that they didn't have, they didn't get married, they didn't have that official relationship. Um, and this would be one of the downsides of not doing that. So people in your direct line, your parents, your kids, your siblings, they're typically going to be exempt. Um, but I also think, Shanta, I think that is my time. So I'm happy to answer more questions in the Q&A.
Yes, please. Did you have anything like really sensitive that you wanted to cover? So for example, you talked about probate, and maybe this is maybe this is not the slides, but for probate, how do we avoid probate? I think that's where the trust comes in.
Yeah, I think when you're talking about probate avoidance, it comes up with trust, but it also comes up with anything that you already made a beneficiary for. So if your life insurance already has a beneficiary, it's not going to go through probate. If your bank account has a payable on death, it's not going to go through probate. If your house is operating under a life estate deed, it's not going to go through probate. So it's really more about, do we have something that lets us set up a beneficiary relationship where it automatically transfers on death? And if you've done that, you can be pretty sure it's not going to go through probate.
Okay. And are the services income driven or is there a fee for service with the Maryland Volunteer Lawyer Service?
We have an income eligibility to our program. So people, if they're below a certain income threshold, then they receive free services.
Okay. And there's a question on how and where do you go to start your estate plan? The Maryland Volunteer Lawyer Service is a resource that we'll recommend. And then we'll also send an email with any other recommendations that you may have. Stephen, I know you mentioned
Mhm.
the Attorney General's website as for a form. I know you mentioned that. Let's see what other question we have before we move on to Dr. Peters. Let's see. I think that's it. There was a how much does a trust cost? Is the cost included in the estate?
I would say for how much does a trust cost, it just, what it does at a high level is that a trust, obviously, I think everyone has in their head that it helps you estate plan, it helps you get you stuff out of probate, it helps you like not pay taxes. That's all true to the extent that you have a good trust. And so a good trust is going to cost you at least a couple $1,000s to set up. Um, there's currently no pro bono like nonprofits that help people do trusts in Maryland. Um, but I do always say that it is a great tool for what it does. So when you want to avoid those taxes or you have someone that you're planning for that you need the money to be managed by a third party, those are the kinds of things that you are thinking about. When you have an adult or dependent who has special needs, you might need something like that. Um, so those are the types of things that you would use a trust, but it is going to cost you more money. If you all wanted to make wills, you could make wills today. You just got to meet the requirements. You could get it signed, get it witnessed. You'd have a valid will. Setting up a trust is much more difficult.
Understood. Thank you so much, Stephen, and stick around for reflection and maybe some more questions after Dr. Sadie Peters presents. So our next speaker, excuse me, our next speaker is Dr. Peters. She is with the Maryland Department of Health, and she's going to talk more in detail about the Maryland Advanced Directive Program. And Dr. Peters, if you're speaking, you may be muted.
There. I'm now unmuted. And do you all see the slides?
Yes.
Great. Hi, everybody. Thank you for this opportunity to talk to you today about the Maryland Advanced Directive Program and a little bit about advanced directives. We are excited to share information from the Department of Health about this program, which is actually in place by law. The legislature had us, the Department of Health, put together an advanced directive program, oh gosh, in 2017. Although there was lots going on across the state for advanced directives for many, many, many decades. Maryland is actually very progressive with advanced directives. Our program and my job are in this particular administration within the Department of Health. We are required to show this slide, so there you have it. I did want to, ahead of time, talk to you a little bit about the small team that we have helping with advanced directives. Lisa Marr is a project manager and communications specialist within the Department of Health. Brian Mattingly, whose main job is as the Director of Comprehensive Cancer Control Programs, also helps. Lauren Nussbaum is the Assistant Attorney General who helps us. And I am the Medical Director in the Cancer Center where this advanced directive program lives. At the end of our time together today, I would hope that you all who are here can understand how advanced directives fits into advanced care planning. I hope that you can outline the key messages of the Maryland Advanced Directive program and that you could describe to somebody else how to get started with a digital advanced directive. I did want to go through some key terms and Stephen actually covered most of this, but I do know that for advanced directives, some of the terms are often confusing. Stephen talked about an agent for financial issues. For healthcare, you would also want to have a healthcare agent. Your advanced directives really starts with a healthcare agent that you name. And again, it's just like a financial agent. It's a person who you really trust to make decisions for you if you're not able to make those decisions for yourself. But these are going to be specifically healthcare decisions. A healthcare agent is sometimes called a healthcare proxy. Sometimes you'll hear that person called as a surrogate decision maker for health. Sometimes it's a patient advocate, or sometimes they're called healthcare representatives. So I said the first part of an advanced directive is naming a healthcare agent. The second part is what a lot of people call a living will. It is the sort of line item of details, lots of details about what you want for your healthcare or what you don't want for your healthcare. Again, if you're not able to communicate what you want or don't want for yourself. So an advanced directive is a healthcare agent and this list of details of things that you want or don't want. But advanced directives actually lies within the umbrella or under the umbrella of advanced care planning. And this is advanced healthcare planning. This is the process of thinking about your wishes for the future, for what you want for your healthcare, discussing your wishes with family and other loved ones. Stephen talked a lot about, estate planning and all of this sort of conversation that has to go into all of these things that might be a little bit hard, but are essential. So you have to discuss with family and loved ones what you would like your healthcare to be or look like, or what you don't want it to be or look like when you're unable to make those decisions for yourself or to communicate those decisions, and then name a healthcare agent and create an advanced directive document. If you are, let's see if the click works. If you are somebody who already has medical issues that might mean that you end up in the emergency department sometime sooner or in a critical care ICU, but it's also important to have a MOLST, which is a medical order of life-sustaining treatment. Medical order of life-sustaining treatment. In some states, it's called a POLST, a physician's order for life-sustaining treatment. It really is the sort of cover sheet of your advanced directive file. So the MOLST and POLST gives you the short list of I don't want to be resuscitated. I don't want IV fluids. I do want to be intubated in these particular conditions. So it's an important document for people who already have serious health issues that might actually require those more advanced health interventions. Okay. I've already described those things, but some people should also consider having a mental health advance directive in which you could list all of the things that you want or don't want for your mental health care if you are unable to communicate those decisions on your own. This is another important piece that people don't think about, but may be important for you depending on your circumstances. As we move across from the left to the right on this slide, you'll see that it's important to share your wishes. Now that you've talked about them, you've written them down, you've named an agent, you have a document, it's important to share those wishes with your healthcare teams. They need to know what to do or what you don't want them to do should you not be able to tell them yourself. And it's also critical to upload those documents into an accessible digital place of some sort. We'll talk a little bit more about that because these days, having a document done is fantastic, but if it's in a filing cabinet at your house or even in a filing cabinet at your doctor's office, and it's Labor Day weekend and you are 300 miles from home across the state at Deep Creek or somewhere on the Eastern Shore, um, and something happens to you and you end up in a hospital there, the doctors at that hospital aren't going to be able to get to your filing cabinet or your doctor's office. So having the document stored online in a cloud-based system where it can be accessible to any hospital is really important. Doing all of this helps to make sure that your treatment wishes are honored and that we have less grief and stress for your family members as they try to figure out what you would have wanted, and less grief and stress for the healthcare providers who are taking care of you as well. Oh, let me go back. It is important, and I put a circle around all of these steps, which include a lot of talking, but a lot of sharing of documents as well. It's important to do these steps in a repetitive manner, meaning that you really shouldn't just create an advance directive and that's that. You don't ever look at that document for the next 20 years. It should be something that you think about maybe once or twice once every year or once every 2 years, and you can discuss your wishes or what you'd like or if things changed for you at family gatherings, maybe at Thanksgiving when the whole family's together, or Easter, or, some other time, family reunions, or some other times when families gather. It's important for your family members to know if things have changed for you. Okay, so as I said, the health department is the hub for advance directives as directed by the state lawmakers. We have created an online advance directive webpage, which has a lot of information, which I will show you in a second. I do want to say that we emphasize that just like Stephen said that estate planning is for everyone, it's for all adults, not just folks who are thinking they're going to die in the next 5, 10 years. Advanced directives are for everyone. Every adult should have one because you don't know what might happen to you next week. And you might be, in a hospital situation, intubated and not able to communicate your wishes. So we encourage everybody to have an advance directive. Our key messages are name a healthcare agent. Just if you don't do anything else, do that. That way the hospital and healthcare providers have someone who they can rely on to help with the decisions about your care. Another part of it is that we'd like you to do it now. Don't wait. Don't wait till you're sick. Don't wait till you're old. Just do it now. And then do it online so that it's accessible. Maryland has a partnership with My Directives, which is a company that it's a third-party commercial company, but it's the only company that in our state has the authority to provide advanced directives online to Marylanders. They were the only company that applied and got approval to connect to our health information exchange and store advanced directives for Marylanders. It's possible there might be other companies in the future that would do this, but right now that's the only one. I'm going to stop. Well, actually, let me try this. Okay, this is the web page. Do you see that? A different page? No? Okay,
No,
then I'll
maybe,
stop sharing.
and then
Yeah,
reshare.
yeah, I'll stop sharing. And
And as the questions come in your mind, feel free to type them in the chat so that way you won't lose your thought.
um,
And while Dr. Peters is doing that, I learned something new about the mental health directive. And that was something that I hadn't thought of. That was kind of like an aha for me. And then also the fact that every adult, even our young ones, 18 or 19, 21-year-olds, everyone should have an advanced directive. For me so far, Dr. Peters, the key takeaway is to at least name someone, at least name that healthcare agent.
okay, are you seeing Maryland Advanced Directive Program home?
Yes.
Great, thank you. This is our home webpage. It's the Maryland Department of Health webpage for advanced directives. We sort of decided that we would hog all the advanced directives information and be the advanced directive hub. So the Office of the Attorney General allowed us to transfer a lot of the information they had on their webpage. They used to be the center for information, and it's now housed, a lot of it's housed on our page. And they've basically minimized their page and redirect people to this one. So if you Google Maryland Advanced Directives, you should get to this page, at least in the first or second choice. We think it's a very pretty page. You can see that we have Name Your Person as the thing that we want you to do. It has links to the My Directives page, and we'll go there shortly, but I wanted to just show you a few other things. It has a very brief definition of advanced directives. Who should make one? Is it easy? Somewhere in here it does say that it's free if you do it at mydirectives.com. We have some frequently asked questions down here, including what if I don't make an advanced directive? And how do I begin? There's another question here. Do I need witnesses for an advanced directive? You do need witnesses if you create an advanced directive on paper. And there are some forms that you could use, but Maryland doesn't require that you use a specific form. You could write out your advanced directive on a napkin, have two witnesses sign it, and that could be a legal document, and you file it, you show it to whoever, give it to your doctors. That could be your advanced directive. But there are some more formal forms that are not just a napkin that are available, and they are available on our website as well. Here on the left, there are resources for individuals. I'm going to click on that tab, and that will take you to this page where you can get downloadable advanced directives forms, again, more formal than a napkin. And there's some things that you can click on that'll get you to versions that are not in English, so that those are helpful to people whose first language is not English and would like to fill out an advanced directive in that language. Most of those also help. They have the same advanced directive in English so that when you hand it to a healthcare provider in a hospital or someplace where your preferred language is not the first language, that you would find somebody to translate. So the providers there would know what you're trying to say to communicate. There are wallet cards that you could write down a little bit of information, like what your name is, where your advanced directives are, that you have an advanced directive. There's information and links to the MOLST webpage, which is a separate webpage, also in the Department of Health, but not part of the Advanced Directive Program. And then there's information on how to choose your healthcare agents, information on how to be a healthcare agent if someone names you as a healthcare agent, and then lots of other information about the broader part of critical care, palliative care, aging with dignity. A lot of related topics are also on this individual tab. The Provider Resources tab has a lot of this same information, but also a lot of information about billing and how healthcare providers can help people start conversations about advanced directives. We like to encourage people as individuals to, again, reach out and talk to family. And again, do it in a way that you start by saying, I want to be able to reduce your stress and anxiety. Should something happen to me, I would like you to know what I would like to happen rather than having there be a lot of chaos and stress while you try to make a decision without knowing what I would like. And then for the providers, we also encourage that providers start that conversation every time they see a patient, ask if they would like to have that conversation, and realize that it's not going to be a one-time a one conversation. It has to be something that people who are, in a clinic to have a lot of other things taken care of, but they can have at least small pieces of that conversation each time in the doctor's office. I'd like to switch now, so I'll stop sharing again, to the My Directives page. Let's see. This is when you click on one of the links to mydirectives.com, this is the page that you will see. It has 3 tabs at the bottom that are the tabs switching. Do you see the 3 tiles? Okay. 3 tabs at the bottom, which you can click on to they'll all take you to the same place. They'll take you where you can set up an account. You have to enter your name, birth date. You can enter an address, and we would like you to enter an address since we're trying to track where in the state people are filling out advanced directives as they use our site. There isn't any need for a driver's license or any passport or any kind of other identification. You do need to put in a phone number because there's 2-factor authentication. So they want to make sure that you are who you are by sending you a message. They do not send you a bunch of other messages. There's no ads. This is simply for this service. You can create your advanced directive or you can upload an existing paper copy. I'm going to stop sharing once more and actually take you to the training environment. Which one day I'll get good at this. One day. It's not today, but one day.
In the meantime, while you're doing that, Reverend Edna Jenkins says it's important to let family know where you have placed your information, including passwords for computers and phone. Where we do have some questions in the chat that we will address after your presentation.
Okay. And are you now seeing My Directives Welcome Back, a login screen?
Yes.
Okay, let's see how long it's going to take to get us in here. Oh. This is a training environment. So My Directives has built an environment in which I can go in kind of like a fake login and allow you to see what you would see if you created an account on My Directives. But this is the login page where you would create a username and a password. It does take a little while to get into the training environment. And I wanted to give you a very brief, go ahead, Shanta, I'm sorry.
No, I was just gonna, while we were waiting, maybe we can answer some questions.
Sure.
Okay, so there is a comment in the chat that churches are in need of this information. And then Daryl Bird wants to know, how safe is my information online?
Wonderful questions. I'll take the second one first. My directives, again, has had pretty tremendous scrutiny from the Maryland Healthcare Commission, which is one of the official tech regulatory agencies of the state. A lot of criteria had to be met in order to allow my directives to link to the information hub that actually has most of our medical data if you go to any hospital. Um, so the information is secure, private, as any hospital or HIPAA compliant hospital information would be. Um, Again, the criteria that they had to meet to be able to do this, and they did this connection in 2014, so they've been in the state, operating in the state for quite a while. Churches, other folks do need this information. We have an RFA, a request for applications out in the world right now, to ask to try to hire someone who would help us to disseminate some of this information and advance directives information in general in the rural areas of our state where it might be harder for people to interact with, websites and online stuff. So we have that plan for rural areas, and which would include faith-based, community-based organizations who would receive this information. And then the two other steps we're going to take with funding opportunities are to try to reach more men, because we know that women typically will say, yes, sign me up, and then men sometimes don't participate in the conversation. So we want to make a bigger effort to reach men across the state. And then there are lots of other groups that we also would like to engage more fully.
So
This
just time check, we're at 6:52.
I have this is actually my last slide, but I just want to walk you through. I don't have any more slides. I just want to walk people through this really quickly. This is the first page that you would see when you create an account in mydirectives.com. I will click here to the left where I am asked, I have not designated a healthcare agent. I could say I don't want to designate a healthcare agent. I would like the people at the hospital to do what they need to do because they know best. But if I unclick that, then I can name a primary healthcare agent, a first alternate, a second alternate. So if I click on naming this healthcare agent, I can put in my brother's name, last name, address, and an email and a phone number so that when this information is retrieved, when it's needed, they'll be able to contact my brother. I can click that I want my brother to have all of these powers normally given to healthcare agent, and those would include whether or not to try to maintain my life at all costs, whether or not to help choose where I die, whether or not to help choose my doctors or hospitals. Or I can say I want to limit my brother's powers and click no on some of these things. When you're done with that, you click save somewhere down here at the bottom. There it is, way in the corner over here on the right, and you move on. Also here on the left, you can click on My Advanced Care Plan. Yes, continue. This asks a lot of questions about the list of things that would be considered the living will. What are your major preferences in health events? Shant, I promise I'll be done in 45 seconds. There are a lot of questions about, what would you like for CPR? Do you want to do everything possible? Do you want to only try treatments that have a good chance of working? There are lots of different scenarios in which you might choose something different. Do you want to have something different if you have a severe brain injury that might be different if you have an accident or illness? I like the section where it says what matters most to me, because this is where I get to write my values. That's this page. And I wrote, I don't want my daughter to feel pressured to make any decisions about my health care. I save and continue that. about religion and culture, I would like my church, my temple, my mosque, my faith group to visit every morning. You can write that in. They ask about your likes and joys. I wrote, I would like strawberry ice cream at least once every day. They ask about what makes you laugh. I would like TV comedy shows from the 1980s played on the TV for at least 2 hours. So you can write in things that you want. But I just wanted to show you that this is what this site was like. You can print what you've written up here in the right. You can send the documents once you've saved them to an email address for your providers or family and friends. You can upload documents that you already have. And I will stop there because I just wanted people to know that this tool exists, that we encourage you to use it, and that everyone should have an advanced directive.
Thank you so much. I actually have a question for the both of you, but before we do, what if someone, this is in the chat, what if someone completes this online and then they move out of state?
It follows you because it doesn't stay in the state if you use mydirectives.com. MyDirectives, fortunately for us, is actually connected to our health information exchange, which is regional. It's Delaware, Maryland, and a little bit of DC. But that company actually is connected to a health exchange, health information exchange in every state. So if I have an accident in Colorado and I'm in a hospital there, the Colorado hospital can pull down my advanced directives from my directives and use it.
Okay, thank you for that. And then for both you, Dr. Peters and Stephen, do you all have clinics or upcoming events where people can actually maybe learn more or get some or have some type of assistance with completing the services that you all mentioned today?
Stephen, you can go.
Uh, we have I would say bi-monthly clinics. That's kind of the frequency. But we operate also all across the state. So we have one upcoming in April in Frederick, Maryland. So if that is close for folks, we actually have a lot of space at that event. But we often do, most of them are in the Baltimore metro area. And then every now and again, we try to spread it out across the state. So probably have bi-monthly clinics, but people could always call if they're eligible. They could always call our intake line and get connected with us. They don't have to wait for a clinic.
In the chat, there was a mention of churches. If a church group and if they had an audience that they could gather for a clinic, is that something that you all partner with, or you choose your locations every other month?
Yeah, no, we definitely partner. They're all community partner driven. So we could do presentations, but like the one I just did, or more a longer form presentation, or we could set up a clinic.
Okay, understood it. Thank you. And I don't see any other questions. There's one, does this show up in an electronic medical record or electronic health record automatically? Or
No.
no?
No, it doesn't. Unfortunately, though the hospitals send much of your medical information regularly to the Health Information Exchange. The Health Information Exchange, you can think of it as a traffic circle. It's not actually a place where things are stored. It's a traffic circle. Hospital A is over here, Hospital B is over here. If Hospital B needs your information, they go through the traffic circle to see your information, which is still in Hospital A. So unfortunately, most of your information goes through you can see it through the traffic circle, but advanced directives, that little path, the pebble path that goes to the health and the traffic circle wasn't ever put in place. So while the road has all of your other information going into the traffic circle, they didn't add the strip of cement for advanced directives. We're working on that, but it might take 5 to 10 years. So putting your information in one of the hospital portals, it will stay there. It will not be seen by the other hospital. Putting it in my directives, my directives is connected to the traffic circle, so it automatically is seen wherever you want to look for it. It's an unfortunate situation, but we'll fix it one day.
Thank you for that. And everyone, this concludes our session for today. It was a lot of information. Even if we added probably another 30 minutes, it would be more and more to give and more to go. Please do in the chat, please complete the evaluation survey. And register for our next peer learning session. It's our fourth peer learning session, and our final one for this program year, and it's focused on caregivers. So managing stress while caring for a loved one with heart disease. And the speaker is a licensed professional counselor. He's a mental health counselor. And so do register for that. The hyperlink is there. And then also, when you complete the evaluation survey, the first 15 individuals you are eligible. You just have to let us know that you want to receive it and send it, and you have to provide your mailing address, and we'll send you a copy of the American Heart Association's cookbook. It's their centennial edition with over 800 recipes. And so thank you, everyone. And thank you again, Stephen and Dr. Peters.
Thank you.
Thank you so much.
Thank you all.